A very good morning to one and all. Myself, Dr. Dhanya KB, reader from the Department of Pediatric and Preventive Dentistry, Minds. Today, we will be discussing about conscious sedation. As you all know, this word is coming into the popularity, saying consent, conscious sedation, sedation procedures, nitrous oxide conscious sedation. There are multiple synonyms used nowadays, which are popularizing in a very high value. So, what is actually the conscious sedation? Let's move and learn about some conscious sedation. So, conscious sedation, as you can see in the picture here, there are many kids which are highly uncooperative. The uncooperative behavior of the child can be due to the fear in them, or the anxiety in them, or the fear of separation from the parents. It can be anything. So, in such patients, or sometimes they themselves will present in a very uncooperative behavior or stubborn behavior, where they are reluctant to do any treatment procedures. So, in such patients, what we have to do is we have to manage the patient to deliver the proper treatment to the patient. So, behavior management alone will be not as useful in such patients where we cannot be able to, or we won't be able to deliver the treatment in a better way. Either we'll have to go for a physical restraints, or we try for a general anesthesia cases, that is treatment under GA. So some patients or some parents might hesitate to do the treatments under GA. They may ask like, oh, such small kids, why under GA? There are so many questions raising in these concern. So there is an alternative in between the behavior management protocol and GA, which is the conscious sedation. So now, what is a conscious sedation? As I've told you already, behavior management, there are two options in behavior management: non-pharmacological management with the use of many techniques, and pharmacological behavior management with the use of medicaments or drugs. As per the definition of conscious sedation, it is a drug induced depression of consciousness. That is, this conscious sedation procedure is using a drug which induces the consciousness or depression in the consciousness, during which the patient they can respond purposefully to verbal commands, either alone or accompanied by the light tactile stimulation. So you should understand that this is just a drug which is used to depress the level of consciousness, but the patient will be highly conscious. The patient's consciousness is not altered, it is just depressed. The patient will be conscious throughout the procedure, as well as they can respond to your verbal commands, or their cardiovascular system function, everything will be proper as the normal patients. So this is just inducing a relaxed or decreased anxiety, where the patient feels relaxed, and the treatment procedure can be undertaken very in a very calm situation. So these are the levels of sedation, which is minimal, moderate, deep, and last one is general anesthesia. You can see here the responsiveness, airway, spontaneous ventilation need, and the cardiovascular function is classified according to the minimal, moderate, deep, and general anesthesia. Where you can see that in all three sedation procedures, there will be levels from minimum to moderate to severe, where the patient's interventions as well as ventilation and cardiovascular function will be usually maintained. But in cases of general anesthesia, the baby or the patient will be sleeping, like sleeping. That means that the patient will not be conscious at all. They will not even realize what is happening or what has happened. So they will be completely in a sleepy mode, where the treatments will be done, and only the procedure, after the procedure is done or after the general anesthesia is over, only then they regain their consciousness. So this is completely different from general anesthesia. What are the prerequisites for conscious sedation? Why or when, before taking up the conscious sedation procedure, what are the things we should be careful about? First and prime thing is the consent. We should get the patient consent, patient assent, or parental consent or guardian consent. This is a mandatory thing. We should always have it. And in cases where the patient is having some medical or some systemic relations or conditions, in such cases, we have to get the physician's consent. Without the consent, we are not supposed to start any conscious sedation procedures. These are the vital signs. You should know the vital signs at various ages, that is heart rate, blood pressure, and respiratory rate according to the age. This is given in the chart here. Where any alterations in these happens during the procedure, you should be monitoring those things, and you should be very careful, and you should be always ready to uh, take any medical emergency services which should be readily available when you're undergoing any conscious sedation procedure. Now, objectives. Objectives of consideration says that, or it means that what all are we aiming to, what we should obtain. Okay, that are the objectives. So all protective reflexes should be intact, vital signs should be stable and normal, patient should be cooperative, patient should be conscious, respond to verbal stimuli, the patient's mood should be altered, amnesia should occur, and patient's pain threshold should be increased. So all these things should be achieved when we are undergoing or taking up the conscious sedation procedure. What are the indications? Where and when you should indicate, or in which conditions we should go for conscious sedation procedure? Any lack of psychological or emotional maturity, patients with medical, physical, or cognitive disability, fearful or highly anxious or unruly patients. In some cases, there will be gag reflexes which are interfering with the dental care. In such cases, also we can take the patient care under conscious sedation. Cooperative child undergoing lengthy procedures, profound LA which cannot be obtained, and children or adults with special healthcare needs. You should note that the adults also can be undertaken in the consideration procedure where their healthcare needs also will be obtained. What are the contraindications for conscious sedation? You should always remember that there is no absolute contraindication for conscious sedation procedure. Even though some situations like ASA classification 3 and 4, latex allergy, recent eye ear surgeries, moderate to severe asthma cases, respiratory tract infections, all these cases, histories of epilepsy, diabetes, all these cases just give you a caution notification saying that care should be taken in such cases. And also sometimes what happens is some patient will be having any obstruction in the nasal breathing situations where you may have adenoids, okay, hypertonic adenoids, or in such situations also you should be taken care, where you should obtain a consent from the physician, then only you should start with the conscious sedation procedure. What are the advantages? As I have told you already, from the general anesthesia procedure and from the behavior management using any physical restraints, like we firmly hold the child with pappus board or physical restraints, from that, what we get the advantage is that there is no hospitalization needed in cases of conscious sedation procedure. You can just walk in, you be prepared with the NPO, just walk in, do the procedure, induce the nitrous oxide anesthesia, do the procedure, and after some time you walk off to the home. So this is a case where no hospitalization is required, where in general anesthesia cases hospitalization is mandatory for post operations. Vital and psychological reflexes are normal and within limits, and patient will be conscious. All the consciousness will be there throughout the procedure. Quadrant dentistry is possible, and you can titrate the drug to the desired effects. Rapid onset and recovery is the most highlighting factor. And there is one more thing, that is parental presence. Okay, in any OT situations where you are undergoing treatments with the general anesthesia, you are not supposed to have any parents or any relatives present in the operatory. But in cases of conscious sedation, you can always have or always ask the parents to be present there for patients, which can help patient in a better way. And patient and parent satisfaction is the prime thing. What are the disadvantages? What are the problems or disadvantages you may come across? The first thing is nasal hood is there, which is placed onto the nose. So nose mask is not accepted by all the patients. There will be difficulty in maxillary quadrant due to the nasal hood and its positioning. Constant monitoring of pulse and oxygen is needed. Monitoring or morning appointments are preferred. Need of NPO is still there. Cost of equipment is very, very high. And need of physician consent for children with systemic disorders also is there. So these are the some of the disadvantages. These are not like alarming features or alarming factors, but still these are the disadvantages. Now, commonly used drugs for conscious sedation. Nitrous oxide and oxygen mixture is the most commonly used, which is the safest, considered like safest drug to be used. Other drugs are fentanyl, diazepam, propofol, and midazolam. Moving on to nitrous oxide and oxygen, they are the commonly used drug, which is because of its rapidity in onset as well as rapidity of recovery. So when you induce, it gets affected fast. When you remove it, it removes the effect also very fast. It has 4 phases of administration. As soon as you induce, so first phase is induction phase. Second one is injection phase, where the sedation will be obtained. And third one is maintenance phase, where the maintain the depth of sedation and the state of analgesia will be there. And the fourth one is withdrawal phase. How do you select the patient? According to the indications and contraindications, you have to select the patients. And special healthcare needs, anatomic airway abnormalities should be taken care. Moderate to severe tonsillar hypertrophy should be taken care. Always elevate the always elicit the medical history of the patient as well as ASA classification 1 and 2. Pre-procedural technique includes NPO, that is nil per os or nil per oral. This says that there is a chart given here which says that up to what limit you should have the liquids or material ingested. So in case of clear liquids, it should be 2 hours before the procedure, breast milk 4 hours before the procedure, infant formula and non-human milk 6 hours before the procedure, light meal also 6 hours before, and fatty meal about 8 hours before the procedure. Let's just talk about an intro part into the equipment, how it is there or what is a commonly used equipment. There are centralized and portable systems available, but most commonly used one is the portable one. As you can see in the right hand side, that is a concert conscious sedation unit, which is the most recently popularized one, which is showing high levels of safety. The main components include breathing circuit, which is a wire component here, flow meter assembly, which is the right hand side picture. Regulators are there. This is the regulators, and pressure gauges and cylinders. These are the this is the complete system where you have nasal hood. See here in the breathing circuit, there is a nasal hood. Okay, so nasal hood be positioned in the nose, which will be having two tubes running away, which is the scavenging cone and Y assembly. And in one, the tubes will be having a slide which will be tightened at the back. Okay, back of the head. This is how the assembly will be positioned onto the patient, and that will be connected to cylinders with flow meter assembly and the pressure gauges. You can see here in the right hand side, the gauges are there. Left side is the nitrous oxide gauge, right side is the oxygen gauge. This knob will be the uh, oxygen knob, and this is a nitrous oxide knob. As you can see here, this right hand side and left hand side, there is numbers written. No, these numbers have a ball inside. Okay, so as you increase the oxygen concentration, the ball will raise and come up to this level. The maximum level will be 7, whereas 70% oxygen or 100% oxygen can be given. Similarly, you have knob here in the nitrous oxide, which has a ball inside, and this also will be increasing or coming up. So based on these two features, it is very helpful for us to know that what titration we are having now and what titration we should have. Like we should either reduce, increase, or reduce. So these are the nasal hoods available. There are two types of nasal hoods available. One is the autoclavable and another one is a plastic or single use type. And we should start the procedure. The procedure will be as normal. Only the induction and the levels of conscious sedation or levels of anesthesia should be noted. And once the patient feels completely free of anxiety and fear, they feel in a floating kind of feel where they'll be very free and all the muscles will be relaxed. At that point of time, you can start with your procedure. And as soon as you end your procedure, you can turn the like gauges off, and nitrous oxide will be completely shut down. Then you should always remember that from the beginning, that is from the starting point and at the end point, you should always remember to give 100% oxygen to the patient about 3 to 5 minutes. So that is highly mandatory. So when you start the procedure, you should always start with oxygen supply. Then you should titrate and increase the nitrous oxide concentration. For child cases, it should be around 4 to 5, and in adult cases, it should be around 6 to 7 oxygen level concentrations and nitrous oxide titration. So at the end of the procedure also, you should always bring the titration of oxygen to 100%. Only pure oxygen should be supplied for 3 to 5 minutes. Only then, after analyzing the patient, you should be allowing the patient to walk away from your clinic. And instructions after treatment is travel home with your escort, stay resting quietly at home, do not allow the child to school or to play. Patient may feel nauseating or drowsy the whole day, and give clear liquids after 30 minutes, followed by juices after some time and solid foods. So all these instructions should be given to the patient. So this is about conscious sedation and intro about conscious sedation, how, when, and how this works, and what is the machine used and all. So, conscious sedation is a technique meant for dealing with dental phobia and for patient comfort, and should not be considered as an alternative to effective local anesthesia or good behavior management techniques. Nitrous oxide is a safe and effective method for allaying fear and anxiety. And moreover, with proper scavenging in the operatories, chances of adverse effects can be minimized. So, always nitrous oxide is a alternate, it is not an alternative option to general anesthesia. It is always a better option. You should be considered that there is an option like conscious sedation. Whenever you are in need or proper indication is met, then you can undergo procedures under conscious sedation. Thank you so much.